Good morning. I am Dr. Tushar Jagtap. Friends, Maharashtra Medical Council election is on, and on 3rd of April, each doctor, more than 2 lakh 1,416 doctors, will be represented by 9 elected nominees. 41 candidates are in the fray. But today I want to discuss with you Dr. Edward De Bonos thinking, lateral thinking, the word which is coined, six thinking hats. And what is six thinking hats in and how its application in medical profession? In six thinking hat, something known as decision making process, how the decisions are made, especially at the corporate level or especially at the government level, and so how we apply that six thinking hats in our individual practice level or at individual decision making or even as a group decision making. So he has given six thinking hats concept. So person who is implementing this project, in our case a doctor who is sitting in a chair, who is going to look after his patient. What he does is that, suppose I'm a doctor, I'm wearing a blue hat and I'm dealing with my patient. So what I do, I wear a white hat. Now what is a white hat? The white hat is a hat of fact check. I want to know everything about the patient, his name, age, address, occupation, origin, duration, progress of his illness, his past history, his family history, his history of medications, everything connected with his illness. Then we see the signs also. So though every facts we should have, we can always investigate the patient and find out what is wrong with him. So white hat is a hat of facts and facts. So once you have all the facts at your disposal, the decision making becomes much easier. After white hats comes something known as a red hat. And the red hat is a hat of emotions. Our emotions are involved when we are dealing with the patients and we are treating with the patient. So we feel, no, okay, I have treated such cases in the past and no problem, I'll go ahead with that. It's going to be all right. Sometimes our emotion says, no, this patient looks a little dicey. I have to be more careful. So red hat is a hat of decision making and that comes into play. So emotions are involved. After that comes something known as a yellow hat, and the yellow hat is a hat of optimism. So he said, okay, this patient is going to be all right. I have to do one, 2, 3, 4. And it's a hat of optimism. We are optimistic about the result in this case and the patient is going to be all right. Then comes the black hat. And the black hat is a hat of caution. Whether you have asked for the history of allergy, whether you have asked for the history of any operations in the past, what is his family history, what is the history of his diabetes, hypertension, metabolic syndrome. We want to know facts. The black hat is a hat of caution. It is telling us that be careful. Have you checked everything? And that's very important because we know there are many cases, sometimes doing surgery, so many things happens. So the black hat gives us an advice, what to do, how to be careful. Ultimately, the whole idea is that the result should be good. And after that comes the green hat. The green hat is a hat of creativity. We have out of the box solutions. Sometimes all of us use them in our practice that to make this patient all right, we use some creative thinking, and that is known as creative thinking. So friends, in this Maharashtra Medical Council election, I know that the election is on working days. I request all the doctors, please come out and vote in this election and vote for Healing Hands Unity Panel's candidate. Our candidates are expert in their field, forensic expert Dr.Sanjay Wathore, community expert Dr.Arun Humne, who was a former dean of Nandurbar Medical College, Dr.Sanjay Baliwant, who is a sport enthusiast and practicing for last 30 years at Pune Cantonment Hospital, and I am Dr.Tushar, Jagtap, practicing for last 35 years, dermatologist and general practitioners. Thank you. Please vote for Healing Hands candidate in this election and please follow Edward De Bonos' 6 thinking hats method in your practice. Thank you.